So anyways, I started my experience in a very positive way. I mean, what that meant, the fact that we talked about it, was that my experience as a kidney in dialysis or a kidney patient was always surrounded by some sort of positive energy, if you like, in the sense that we embraced the treatments that came with it, whether it was pills that we had to take or dialysis that we had to perform. And so very quickly when the nephrologist advised that I should do that. So it's always been, we've always felt as patients that we were surrounded, well, we were well taken care of. There was a safety net somewhere, and that we could feel bad and feel really awful, but in the end, hospitals were there and they would take care of us. So that's what happened. I started dialysis. At the same time I was studying, so I did my master's in education. I'm in education, in higher education, and then I did my PhD. And most of my PhD I wrote sitting on my dialysis sofa at the university, which was quite an achievement. And I think the experience of going through dialysis really transformed me in many ways, in the sense that made me listen to myself a lot more and more being able to name things for myself and so on. So that's the general background. That's where I come from. I finished my PhD, and the next day I got hired at the Center for Pedagogy for Applied Pedagogy for the Health Sciences, le CEPAS, it's called that, to work on medical education, basically. And that's what I've been doing ever since then, in 2010. And at the same time, at the Faculty of Medicine, they started the patient partnership movement, which became the Direction Collaboration Partenariat Patient. So I very quickly became, I was sucked in, I say, because of my patient experiences and because of my research background and because of all those things. It was a natural fit with these people, who's a well-known figure in Canada with patient engagement. And I started working, and I started doing different things, namely going to train people about integrating patients in care and care delivery and so on, but also slowly into research activities.